Okay. All right.
It's counting down. Good morning, everybody. Thank you so much for joining URL and Aetna today with a webinar that we have in store for you. We're going to do a deep dive on LIS and what Aetna offers those individuals with their plans, and a little more education, which is always a lot of questions that we get around LIS and how that affects the plans. So we do apologize today. This was supposed to be an in-person seminar. Unfortunately, things happen, but I think it was for a good reason that we have this as a webinar now today, because we do have it recorded. You'll be able to go back and watch it on demand at your convenience, and it's going to be some great information today. There is a blue chat button on the bottom right of your screen. Go ahead and click that, and that's a way for you to ask questions to myself, Amy, or even talk within the other audience members today. Obviously, you can email Amy or myself after the webinar if you have any questions that come up after the fact. But we hope you enjoy the presentation today, and I'm going to roll it over to Amy Curran to get us started.
All right. Thank you, Christy. Really appreciate the introduction and allowing us to have some time to go over this really good information that I have for you today. And like Christy said, submit questions into the Q&A chat box. I will probably get to them at the end of the presentation. I don't believe this presentation will take a full hour, but definitely, send me your questions or put them in the Q&A, and I would be more than happy to look at them and at the end of the presentation. This presentation, goes over, I'm just trying to make my screen bigger, but this goes over a lot of information on our Value Plus PPO plan. So this plan, we're going to focus on low income subsidy, and that is, help with paying for your prescription drug plans. So I'm going to go over that in greater detail as well. So I did actually have some handouts printed out to bring with me today, but since we had to change it to a webinar last minute, what I will do is I'll get a list from Christy and everybody that attended, and I will just go ahead and email out those 2 flyers that I had printed for this meeting. And, I can get information. I can also get you this presentation afterwards as well. It does go over a lot of really good information. So let's go ahead and get started. Again, we're going to look at low income subsidy, and in particular, our Aetna Medicare Value Plus PPO plan. Now, this plan is in central Pennsylvania. It's also out in northeastern Pennsylvania. We have Value Plus PPO plans throughout the Keystone market, but we're just going to focus on the one in central Pennsylvania today. So let's get into it. What is low income subsidy? You might hear it as extra help. You might hear it as LIS as well. That's one of, we have so many acronyms, abbreviations in the insurance world, as you guys know, and one of them is LIS. That's always what I refer to as LIS, but it's also low income subsidy and extra help. It is a federal program for Medicare beneficiaries who have limited income and financial resources, and it does help pay for Part D related costs. Social Security determines eligibility for the full plan year, and I do have limits, the income limits, the asset limits. I have all of that information coming up here for you in some slides here. But they also look at continued eligibility of current beneficiaries, and then they get new requests and new Medicare beneficiaries throughout the year. So, they're constantly, you can apply and become eligible, say, in the middle of the year if things change with your income or your assets. You could certainly, I have resources to show you how to help determine if somebody is eligible for low income subsidy. And like I said, they may become eligible middle of the year. And that would give them an SEP. And then, they could also switch to this Value Plus PPO plan if they aren't already on it and LIS eligible. So it's just a good contact point as well. Every, quarter, reach out to your clients. You never know what you might uncover as well, and see if somebody's eligible for LIS. Like I said, this program does help pay for Part D prescription drugs. This is the Part D portion of the monthly Medicare premium. And it also takes care of that annual Part D deductible. And then also they have specific prescription coinsurances and copays if somebody is low income subsidy. So generally, if you see somebody is paying like $0 for, tier 1 or $3.60, I believe it's for tier 2 or other tiers, that kind of clues you in that they have low income subsidy. But again, I will get into all of that information here in a little bit. But that's just what low-income subsidy is. It is not Medicaid. Get that question a lot. Low-income subsidy is different than Medicaid. So who qualifies for low-income subsidy? There are so many people out there that qualify for it, don't realize that they do. So that's really, really important, that this is just another avenue for you to get out in front of your clients and new people, helping them save them money by getting them qualified for extra help if they meet those requirements. So and like I said, I will give you all of those resources here coming up. But a beneficiary will automatically qualify for extra help when if a beneficiary receives Medicaid and has Medicare. So if they have Medicaid and have Medicare, they automatically qualify for low-income subsidy or extra help. They also automatically qualify if the beneficiary's Medicare premiums are paid by their state. So that is a Medicare savings program. And then the beneficiary receives supplemental security income payments and has Medicare. So those three bullet points, these individuals automatically qualify for extra help. But there are so many more people out there that they do qualify, but they don't realize it. That is where their agent comes in, and where you can help people. You help people get into LIS. They're in turn going to send you referrals as well. So it's just a win-win for both you, the agent, as well as and prospects out there. So definitely a good thing, a good training to have to understand low-income subsidy, because there are so many people out there that don't realize that they qualify for low-income subsidy. And as I mentioned, all dual eligibles qualify for low-income subsidy, but not all LIS eligibles are dual eligible. So just because somebody has LIS doesn't necessarily mean that they have Medicaid. I mean, they could have Medicare, Medicaid, they have automatically LIS. But, I have brokers, they try to enroll somebody in our DSNP plan, which is for people with Medicare and Medicaid. And I come to find out that they only have low-income subsidy. If that is the case, if they only have low-income subsidy, they wouldn't qualify for our DSNP plan because they don't have Medicaid, because LIS is different than Medicaid. So that is one really strong point that I like to point out. Again, because I get questions on it, people think that, because they have LIS, they're automatically eligible for a DSNP plan. But if they don't have Medicaid and they have LIS, then this is where our Value Plus PPO plan really comes into play for these folks. And, they get some really great extra benefits at a $0 cost premium. So let's look a deeper dive into a low-income subsidy. If a person with Medicare applies and gets extra help or low-income subsidy, they will qualify for a quarterly SEP. So if somebody has low-income subsidy, they qualify for a quarterly SEP. This is for the first 3 quarters of the year. And then once the last quarter comes along, then they would just use their AEP election. So LIS do qualify for a quarterly SEP the first 3 quarters. And the SEP is used the month the application is submitted, not the month the plan is effective. And these folks that have LIS will no longer be responsible for paying a Part D late enrollment penalty. So if they have a Part D late enrollment penalty and they become eligible for LIS, that Part D late enrollment penalty would be removed for the individuals. They do not have to pay for cost of prescriptions during the coverage gap donut hole. So that is also true for LIS folks. But they would be auto-enrolled into a Part D plan if they do not choose an MAPD, excuse me, or a Part D plan for themselves. So these individuals, are constantly monitored, and if they see that they don't have a Part D plan, they would be auto-enrolled into one. But if they would enroll in this Value Plus PPO plan, that includes a prescription drug plan, so that wouldn't come into effect wouldn't be auto-enrolled into a Part D plan if they would enroll into our Value plan. So people who qualify for extra help may or may not qualify for Medicare savings programs or their state's Medicaid program, which I already talked about. Income requirements for extra help eligibility, they may be higher, and they may not qualify for Medicaid or financial assistance or for other financial assistance programs. So extra help, as I mentioned throughout the presentation, but it is not Medicaid. It's something completely separate from Medicaid. The Inflation Reduction Act, this did increase. So it was at 135% of the federal poverty level, but it now increased to 150% of the poverty level. And this is really increased the individuals that are in low-income subsidy. There's more people that are eligible to be in a low-income subsidy plan. So this really drove our expansion of the LIS targeted portfolio that we have. And then also we were focusing on marketing and sales opportunities as well. The resource limits were adjusted every year. So every year it changes. So, make sure you remind your clients of that every year the resource limits are adjusted as it is for all of the different levels out there. And then the out-of-pocket cost is capped for Part D at $2,000 per year. So that is for people with low income subsidy and also the Inflation Reduction Act. And then also, this is really important, as of 1/1/2024, there is no longer partial LIS. So if somebody qualifies for low income subsidy in 2024, they have low income subsidy. So if you remember in years past, there were different levels of low income subsidy, 100%, 75%, 50%, and so on. For 2024, it is just one level of low income subsidy, and there is no more partial low income subsidy. So as I mentioned, I do have some limits for you and how somebody would qualify. So up first is the 2024 asset limits for extra help eligibility. Assets, you guys know this, but some examples of it are real estate, bank accounts, stocks, bonds, savings account, cash. You can see that, this is just some examples. There's, an extensive list online. But for extra help for assets, you can see that for a single individual, it's $17,220. And then for a married individual is $34,360. So those are the limits for assets. Certainly, if somebody would have questions on that or, need additional information, they would want to contact Social Security. That's ultimately where they would go also to apply, with some other resources that you can use to help somebody apply for low income subsidy as well. So that is the asset limits for extra help eligibility. And then let's look at the income requirements for extra help eligibility. And again, these limits that I'm showing to you, they change every year. So this is for 2024, and they look at income as the earnings for an individual or family They will look at examples of income. And again, this is not a full list, but they look at Social Security income. They also look from support from other family members. Some examples that do not count as income is food, mortgage, utility, and property taxes. So that is how that works. But as far as the limit goes for extra help, single is $22,590. And then married for income requirements for low income subsidy for 2024, married is $30,660. So again, these are the limits. They change every year, but these are for 2024. Just to give you kind of an idea whenever you're talking to individuals to see if they might qualify. But, certainly it's always worth a try to see if they qualify by, doing a couple things that I have for you later on in the presentation. All right, let me go to the next slide. So the 2024 RX copays for LIS, you will see that our members for Value Plus plans, they do qualify for $0 RX copays. But here are the copays for those enrolled in MAPD plans. You can see this grid. It's a little confusing, but $0 for full benefit dual eligible. So those people with low income subsidy, generic is $0, brand is $0. You go down the line, the copays get a little bit higher as you go down this grid that you see there, just depending on their LIS eligibility. But once they would enroll into a Value Plus plan, that I'm going over today, they will qualify for $0 RX copays. And then obviously all of our plans, as well as, once they're in low income subsidy, they do not have a $0. They do not have a deductible for their prescription drugs. So this is just their cost share table. Certainly you can refer back to it if you would like later on after this presentation. So let's look at our strategy and some other helpful information on our Value Plus PPO plan. So who will be interested in our LIS targeted plan? As I mentioned, we do have that Value Plus PPO plan. It is for people that don't qualify for LIS. So people that don't qualify for LIS are general enrollment folks. Can still enroll into our Value Plus PPO plan. They get enhanced benefit with a $0 premium plan. They'll have the copays out of pocket. They have a lower maximum out of pocket. So it's a really strong plan for people that don't have LIS and, want to just enroll in that plan, a general enrollment customer. My parents are enrolled in this plan. They have been enrolled in this plan for a very long time. They do not have LIS, but they still really get some great benefits out of this plan. And then obviously for people with low income subsidy, they can receive this plan, $0 premium plan. If a general enrollment consumer does enroll in this plan, they do have a premium of $14.60. But if you are low income subsidy, you can receive this plan, the Value Plus PPO plan, for $0. They get a $0 deductible and reduced RX copays if you're LIS eligible. They get some extra benefits as well in this plan. Individuals that are partial dual, these individuals that are partial dual, so they have Medicare and Medicaid, but they are not full dual, they could also enroll in this plan. They LIS premium subsidy, $0 premium plan. Again, they do not have Medicare cost share protection, so they are not eligible for our DSNP plan, as I mentioned, but they could certainly enroll in this plan, LIS targeted plan. For partial duals. Now, full duals, we do have a DSNP plan. So this presentation that I'm reviewing is our, across the United States presentation. But for full dual eligibles, they really should look at our DSNP plan. They would be way better off than our LIS targeted plan, but we do have our full dual D-SNP plan available. So you don't have to worry about that column because they would obviously want to look at our D-SNP plan. But again, general enrollment can enroll in our LIS targeted plan, value plus PPO plan, LIS eligibles, as well as partial dual eligibles will certainly enroll in our value plus PPO plan, our LIS targeted plan. So why does this matter? Our LIS plan, it really gives these individuals a rich plan with really competitive copays, $0 plan premium, and then they also get all of these extras. They get an OTC benefit. They get fitness through Silver Sneakers. They get a fitness allowance. I know that's not listed on this slide, but they get all of those extra benefits for a $0 plan premium. So that is amazing with this plan. They will also, if they're low income subsidy, will also get an extra benefits card to go towards healthy foods as well. So these individuals, they get extra benefits as well under this plan for low income subsidy. Whereas the general enrollment folks, they pay the $14.60. They get all of these extra benefits, but they would not qualify for that healthy foods card. I get that question a lot with this value plus PPO plan. That healthy foods card that you will see on the plan guide or in the summary of benefits, that is for people with low income subsidy only. So that is the difference, but they also get all of these extra benefits for $0. So it's just a phenomenal plan, especially for these people that are low income subsidy. Some of these are repetitive, but members eligible for LIS, they will get $0 Part D drugs, $0 deductible. They would get on our Value Plus PPO plan, they will get an extra benefits card for healthy foods only. So this bullet point right here, the extra supports allowance, disregard that. I will actually need to update this slide to make it more for Central Pennsylvania, but they get a healthy foods extra benefits card with our Value Plus PPO plan. Plus they get the over the counter, which is the same. They can go to in-store CVS, order online. They would just use their member ID card for that, but they would get a separate card for their healthy foods benefit if they are low income subsidy and they are enrolled in the Value Plus PPO plan. Let's see. Eligibility requirements. So I went over the assets. I went over the income limits for eligibility. But as some of this is repetitive, and it's always good to do repetitive, especially during a webinar, because I know it's hard not to multitask. So, you'll catch bits and pieces here and there, but don't forget that there is no longer partial LIS. So anyone who meets the LIS income and asset requirements that I went over previously, they would qualify. So members in the plan, to get some of those extra benefits and a plan premium for the Value Plus PPO plan, they do need to qualify for low income subsidy. Aetna must receive an LIS indicator from CMS. So we need to get an LIS indicator from CMS. Self-attestation is not allowed in this. So that means an individual can't just call in and say, hey, I'm eligible for low income subsidy. Can I get, the Value Plus PPO plan for $0? They cannot self-attest. We must get an indicator from CMS letting us know that an individual is low income subsidy. The member will then be deemed eligible. The member will then be sent a notice of benefits letter explaining all of the additional benefits and how to gain access to all of that. They will then also an extra benefits card. But in turn, Aetna sends a member eligibility file to Nations Benefits, and that is the company that oversees our extra benefits through Nations Benefit. And then they would then send out a card to these individuals for their healthy foods benefit for low-income subsidy folks. So, if you have somebody that is low-income subsidy and they didn't receive a card from Nations Benefits, that's when you would need to contact, either member services or your broker manager, and we can certainly look into that for you. Constantly looking at a daily feed of low-income subsidy folks. So we do get that feed 3 times a week. Actually, now it's daily. That we get that feed to let us know if somebody is low-income subsidy. I have seen that somebody is on the Value Plus PPO plan. They don't have low-income subsidy, and then they might have applied in the middle of the year, and then we get through that feed that person is now low-income subsidy. We would then send that to Nations Benefit, and then they would automatically get a card. So sometimes it happens in the middle of the year, and the members don't need to do anything. We will automatically switch them to the LIS portion of the Value Plus PPO plan, and they would get sometimes people get a card in the mail and they don't realize what it's for, but sometimes it does happen mid-year that they become low-income subsidy eligible, and they might be already enrolled in the Value Plus PPO plan, and then they just get these LIS extra benefits through that plan. So extra benefits card activation, new members will receive their card in the mail when they receive eligibility determination. So when we get that file and let somebody has low-income subsidy and they're on the Value Plus PPO plan, they would then get a card in the mail, and then they have to activate it. So renewing members will not be recarded. So if they had a card in 2023, the card, they wouldn't receive another card. 2024 benefits would be automatically on existing cards. So, most likely now that we are well past AEP, it would be new members receiving their card in the mail. So keep that in mind as well. But if you do have questions, about somebody that you thought was eligible, we can certainly look into that for you, or you can always call member services as well. They will get a member guidebook that is sent to new and renewing members. The letter includes wallets and allowance amounts, so they'll let them know what they get with their healthy foods. We also have a list. There is a list online of where individuals can go to get their healthy foods. There is a certain network of grocery stores. It is a lot bigger than it was last year. So it has expanded. So if you would need that is on Producer World. Also, your broker manager would have a list as well. If you would like that, we can get that over to you. But I don't have the list in front of me. I would go through them, but I don't want to, give you misinformation. But, a lot like Walmart, I know, is one of them. I think Giant Food Stores was added as well for healthy foods. So that is an addition for 2024. But we have other, locations as well for the healthy foods. But so they got things, and that is what happens when they become eligible for income subsidy on the Value Plus PPO plan. The LS plan, so the Value Plus PPO plan that I'm talking about is loaded into ThinkAgent. You will see that there is a VBID LIS, so value-based plan. So VB means value-based. That you will see that on ThinkAgent. But again, anyone can enroll in these, but they do need to qualify for LIS to receive the additional extra benefits that I talked about. You can also verify, I don't know if it's on the next slide, but you can also verify, yes, you can. So you can also verify on ThinkAgent at somebody's LIS status. So that is really nice. I don't know if it's up and running again since Medicaid was hacked. So I know that the Medicaid eligibility was taken down off ThinkAgent, but you can also probably do it through URL's site as well. But use ThinkAgent. You can also check somebody's LIS eligibility right there. That kind of gives you everything that's needed. Definitely the last name is needed, the date of birth, and as well as their Medicare number. And then it will tell you if they are low income subsidy. Also, you can check somebody's Medicaid status. That's really nice. I use it all the time. I believe it's still down. I was off last week, but I haven't received an update since. But so some really good things on ThinkAgent. If you don't use ThinkAgent already, I know some of you may use URL's portal, so they're very similar. But again, if you want to start using ThinkAgent, you can certainly, reach out to your broker manager and we can get you training on that. You can check somebody's LIS status. You can enroll them into a value-based plan, the Value Plus PPO plan as well. I went ahead, but so to check LIS status with ThinkAgent, last name, date of birth, Medicare number. That is generally what we need to verify if somebody has extra help. And you would just simply put in that information and then click on verify extra help. It will tell you the start and end dates. I will say that, the start date 11/2023, ignore that end date. I don't, it's confusing, but it's the same date as the start date, or that means they have low income subsidy. I know it's a little confusing, but if they were, it would have a different end date if they did not have low income subsidy. But I ran into that once. A broker had me check it, and I'm like, I don't understand, but it was a different end date, and that means they were not eligible anymore. So if they do not have low income subsidy, it will tell you no records found. Now, if they did have it, and you would see that on the end date section, it would be a different date than the start date. So hopefully that makes sense. I know it's a little confusing, but that's how that works. But if they never had LIS and they don't have it, it will be no records found. And then that's where you could maybe do a benefits checkup, which I'm going to get into here shortly, to determine if somebody is eligible. I get ahead of myself, but so 3 ways to verify low income subsidy. Certainly ThinkAgent's right there. It's all in one place. You can enroll somebody right there. There's also a benefits checkup, which I'll go over here shortly for you. You can also call our services department. Prompt 7 is the same place you would go for Medicaid verification. You would do prompt 7, and also for LIS as well. So again, that will just connect you to the enrollment team, and they would be able to verify that for you. And then also you can go to Medicare.gov as well. But really, ThinkAgent is probably your best bet because everything's in one place, Broker Services Department or Medicare.gov, to verify if somebody is low income subsidy eligible. And then they also can, once you're ThinkAgent, you can access benefits checkup. So benefits checkup, I've talked about it many, many times in my tenure as a broker manager. This is a way to find money saving programs for your clients. So really, I believe it's 55 and older can use benefits checkup. You would just simply put in their zip code and ask questions. And it can then verify, it can actually tell them if they would be eligible for low income subsidy and qualify for that. So benefits checkup is a really great tool. This is a great tool to take out and, do events. If you go into high rises or low income housing or something like that, I set up tables there and just offer benefits checkup appointments. And then, like I said, you type in these individuals' information, and then it would tell them if they qualify for low income subsidy or PACE or many different programs. And then they can apply for for low income subsidy right there for these individuals. So really, really great program to get used to or to learn, I should say. If you have questions on that, certainly reach out to your broker manager. All right. So how to apply for low income subsidy? Obviously, I already said benefits checkup. They can also go to the security website as well. It's ssa.gov /extra help. So those are the 2 online links that they could go to. They can certainly call and apply over the phone or request an application. That phone number is right there for them. Beneficiaries also can apply in person if they do want to go to their local Social Security office. So a couple ways for them to apply. Certainly, as I mentioned, it's really great for an agent to do events, especially for benefits checkup. You uncover somebody that has low income subsidy. If they haven't used their quarterly SEP for LIS, they most likely didn't because they're just applying now. That would open up an SEP for them. And then, you could enroll them into the Aetna Value Plus PPO plan. You save them money, and ultimately they're going to refer people to you as well. So definitely utilize benefits checkup as an agent. Many great opportunities for you if you do use benefits checkup. But after submitting the extra help application, the application will be reviewed. They will be sent a letter letting them know they qualify. Just know that the process can take 4 to 6 weeks for it to go through and determine if somebody is eligible. This is just documents for application completion. So I know I have a broker that does some benefits checkup events, and they have, at a senior high rise, and he has people set appointments to come and see him to do a benefits checkup. He actually will give them a list of what is recommended to be able to fill out an application for low income subsidy. So, you could screenshot this list. You could take a picture of it with your phone if you wanted to, just so to make it seamless and to keep things rolling along, not to delay things. These are the things that they would need to have on hand to apply for low income subsidy. So you can see that right there. But again, I have an agent that just takes this list with him wherever he goes in case he has somebody that is low income subsidy eligible. LIS frequently asked questions. So again, premiums, LIS targeted plan premium for 2024 is $0. So for the Value Plus PPO plan that I do have a slide on that briefly coming up, it is a $14.60 monthly plan premium. If they qualify for low income subsidy, and we get that indicator from CMS that they are low income subsidy, that plan for them would be $0. So really nice. If they're low income subsidy, they get a plan for $0, our Value Plus PPO plan. Anytime you see the name Value Plus in any of our plans, this goes for the Southeastern area, this goes for Western Pennsylvania, that just clues you in that it's a value that is an LIS targeted plan. What happens if a member loses LIS? Members are notified in September of the previous year that their LIS level was lost. Members do have until the end of the previous year to call into the plan to say they reapplied. So they'll be notified if they lose their LIS, and certainly could try to reapply as well. A PCP selection is not required for our LIS plan. It is a PPO plan, so a PCP selection is not required. Obviously, we like to have the PCP selection on an application, but our plan that I have in Central Pennsylvania is PPO, so a PCP is not required on that application. With one exception, and I'll go over that here shortly. So marketing LIS plans, we do have on the Aetna Medicare portal, we have a flyer on extra help. This is where you could take this to a senior high rise. If you can get it into a doctor's office, you can leave these out. You can customize them with your information as well. Again, you can do that through the Aetna Medicare portal. There's also a flyer, an educational flyer out on Producer Worlds. I also, like I said, I do have 2 flyers and I will email them to you. I got them printed for today, but as I mentioned, things had changed. So I will get you some other flyers emailed out to you. But if you do want other, customized flyers, you can also let your broker manager know, and they can assist you in getting you flyers with your contact information on it. So this is just our benefit grid. As I mentioned, I'm just going over for Central Pennsylvania. So you'll see that there is a Southeastern Pennsylvania available plan. There is a Western Pennsylvania Value Plus PPO plan, but I'm looking at the Central Pennsylvania Value Plus PPO plan. As I mentioned, it is a plan premium of $14.60. Maximum out of pocket on this one is a little bit lower of $6,900. So you will see that PCP 0. So really strong, strong benefits for these folks, especially if they have low income subsidy. This is a $0 premium plan if they have low income subsidy. It's a per stay inpatient hospital copay. They also get an over the counter of $135 per quarter. So that is just, they would use their member ID card. They can go into the CVS stores. All standalone CVS stores do participate in over the counter. They can order online or by phone. They also, folks, get a $3,000 dental, $300 eyewear. They get a fitness allowance of $600 annually. And this is all for $0 plan premium if they have low income subsidy. So, but again, general enrollment people can enroll in this Value Plus PPO plan. So, it's not just for low income subsidy folks. You can see the copays there as well, some other copays. They would get a healthy foods card of $75 a month. $75 a month to use towards healthy foods. That does not roll over, so it's use it or lose it every month for healthy foods. Also, HVP is a high value provider. So get a lot of questions on this, but we work with Oak Street. Oak Street is, it's more of like a health concierge provider practice that they are really hands-on with these folks, with their members. They give them transportation. They do lab work there. They really get them the care that they need. They get a specialized plan, individualized for them. Their doctors and nurse practitioners really take the time with them, and that is through Oak Street Health. So if an individual says that, yes, my primary care is an Oak Street Health doctor, and they're listed out on our provider directory, they would also get a $30 per quarter extra benefits card as well, if they identify that they go to an Oak Street provider. So as I mentioned, I was talking about the PCP previously, and I said with one caveat, is not required unless they go to Oak Street. We do need that no-take application so we can then issue this $30 extra benefits card to these folks. So Oak Street, they're big in Philadelphia, is one area, but we now have them in Lancaster, Scranton, Williamsport, I believe. So I know Chris, my manager, is on the phone. So we're in Reading as well. So I know that they're opening up in York here soon. So really, really great program for these folks through Oak Street Health. That is what that VP that you see, a high value provider, that's what that means. They need to utilize an Oak Street Health facility to get that $30 extra benefits card. So I get that question a lot. And Oak Street Health is great. If you have questions on Oak Street Health, reach out to your broker manager. We can get you in contact with, the head director at Oak Street Health. See if you can work with them directly. So really great opportunity with Oak Street and Aetna Medicare, and especially this Value Plus PPO plan. So I think that's a whole other training on Oak Street Health is just a whole nother webinar on that. But that is what HVP means whenever you see that in the okay. So our Value Plus plans, we already saw this slide. They get all of those extra benefits, including dental, a lower maximum out of pocket, low income subsidy. If they have low income subsidy, it is a $0 plan premium. So really great. Again, you need to get out there and identify these folks. As I mentioned, so many people don't know that they qualify for low income subsidy. And you can go out and help these individuals, which in turn helps them, helps you, and then you can get some referrals as well. And they get this great plan, $0 plan premium with all of these extra benefits. Plus, they get a Healthy Foods extra benefits card. So really, really great plan. Certainly, as mentioned, our high value provider, that is through Oak Street. Mentioned that already. They would get an extra bonus amount added to the extra benefits card. So this is loaded. Quarterly on their card. So it's $30 per quarter. If they use an Oak Street Health provider, they would need to notate on their application they use an Oak Street provider. And those codes can be found on the provider lookup online. So if you do have questions on that, certainly reach out to the broker manager if you would need assistance with that. But these individuals will get an extra $30 quarterly to use towards these items that you see on your screen. The extra benefits card, again, some repetition. Our extra benefits card for 2024 with the Central Pennsylvania plan that I'm reviewing, it has the Healthy Foods wallet. All of these other, the over-the-counter wallet, the extra supports wallet, that does not come into play with the Central Pennsylvania plan. Our extra benefits card is for people with low income subsidy on the Aetna Value Plus PPO plan, and it is for Healthy Foods. If you do need a list on Healthy Foods, we can certainly get that to you. Also, any locations, we can get that to you as well. And again, don't forget, if they use an Oak Street provider, have them put that on their application so they can get an extra $30 per quarter on that one, on their high value extra benefits card as well. So that is all I had for you. I know I went over a lot of information pretty quickly. We have about, it looks like 10 minutes left. Let's go in, let me see. All right. It looks like I do have some questions. Is the low income subsidy criteria to qualify state or federal? Glenna, I'm not sure of that answer. I believe it's state, but that's something that I would need to verify for you because I'm not sure about that. Do you have flyers specific for LIS that producers can add their personal information? Yes, we do. There is a benefits checkup flyer out on Producer World. Out on the Aetna Medicare portal. That is formerly the Medicare Marketing Studio. It was renamed to the Aetna Medicare portal. And there is a flyer, the flyer that I showed a couple slides ago, that is the flyer on benefits checkup, and you can add in your information to, have that personalized, and then you can take that with you, wherever you want to put it at, as long as, it's within CMS compliance. But yes, you can add your information. You can have that printed from the Aetna Medicare portal. You can also download it, save it as a PDF. And, you can print it also at a local print shop if you download it and save it to your desktop. But there is a flyer out on the marketing portal out there for you that you can customize. This presentation, we can send it over to you, Ricky. I know that you are assigned to Michelle, so I will send her a note. We can get you that information. Also, the handouts, the 2 flyers that I have that I got printed, we will definitely email them out to everyone that was on this webinar. I'll get a list from Christy, and we'll make sure that this information as well as the handouts that I had printed. Like I said, I know it's a lot of information. Hopefully you did find it helpful. Value, I cannot stress enough. The Value Plus PPO plan is just a phenomenal plan for 2024, especially for people that have low income subsidy. Just a really great plan. Definitely look at it. Definitely learn more about low income subsidy. Not only will it open up opportunities for you and at this time and at AEP, but it'll help your clients out as well. So if there aren't any other questions, I really thank you so much for attending today and also making that short, brief change that we added in last as far as webinar goes. But as Christy mentioned, I like the webinar because it is recorded, so you can always go back and refer back to any of the slides. So that's all I have for you today. So thank you so much.
Thank you, Amy. And yes, the webinar was recorded today. It'll be out on our library, on our website. You can watch it, I believe, after an hour. It'll be up there. We'll have the handouts here also at URL. If you need them, reach out. And the question from Glenna, the LIC or LIS is state. So if you move to a different state, you need to go through the process all over again. Yeah. But thank you so much, everybody. I appreciate you joining us. Thanks, Amy. Great information. Really always appreciate having you. And catch everybody soon. Have a good day.
All right. Thank you.